People often forget that public health is responsible for most of the health improvements over the last century. When we look at longevity and life expectancy, people forget. We look at medical advances and we forget about public health. And where we are right now as a state is we need to make public health work. And so we're figuring out how we do that better, and we certainly can't do it without our local partners. We are a decentralized state, and so what that means is oftentimes the state gets the resources from the federal government, and then we help allocate them to the folks on the ground who are really doing the work in our communities. And one of the ways we're trying to make that work better is by improving some of the mechanics. Now, this part isn't pretty. It's looking at how we contract, how we develop different indicators and performance measures, but to make it work in close collaboration with our local partners to say, what do communities really need? How are we going to measure those results? And how do we get the paperwork together to make that happen? And a piece of this is figuring out how we not just go in piecemeal and say, as the lessons of public health over the last century has been, we need everything. We need to work on our clean air and make sure there isn't lead in our access to our children, and the water is clean, and people have access to respectful maternity care and all of that. We need to do it all. And the way we do that is not by funding individual siloed initiatives, but by really having a groundswell of support in our community for the work. And so what we're doing concretely in North Carolina is figuring out how we resource these foundational capabilities. So how we communicate, how we do policy support, how we do data and equity work, all of these things that we know are so central to public health, and how we invest in them holistically so that whether you are doing a smoking cessation campaign or you're working on COVID response and vaccination, those same skill sets can be applied to serve the whole community.
In North Carolina, we're taking almost a tiered approach to our modernization and transformation of public health, and that we have already local governmental public health that is at work. We have our state partners at Department of Health and Human Services already at work. And then we have a multidisciplinary North Carolina Institute of Medicine task force that is made up of many stakeholders that do include local governmental public health, state governmental public health, but also the business community, our hospital partners, philanthropic agencies. And that tiered approach is really looking at what are the immediate things we can do. So when we think about the what we call our North Carolina Association of Local Health Directors, which is our local SACHO, that's State Association of City and County Health Officials, the work that they're doing right now, they went through a process using philanthropic funds to create an action plan of what are the things we can do right now while we wait for these big visions to come through those recommendations. And some of that is really getting down into job descriptions and job qualifications of the folks who are doing the work, and what are the capabilities and the trainings that we need them to have so that they can best plan for, so they can best respond and be ready for what we're ready to do in public health. So that's one tangible thing. And also looking at what is the current data that we have, not just the population health data that we have, which is very important and helps drive a lot of the decisions, the programming and the operations that we have both at a local and state level, but what are the performance data that we need to be looking at that shows not only how does this affect our communities, but how does the work that we're doing become more efficient? How is it how is it effective? What outcomes are we seeing? How can we do our own quality improvement within our own operations to better improve our programming so that we can do the best to improve our opportunities of health and reduce disparities and inequities in health and have the best programming for local and state public health?